We had a preliminary round in the morning. There were 16 participants, and after elimination, we have selected 10 participants to participate in the main quiz. I'll announce the names of the participants who are selected, and I request them to please come forward. These names are not in order of their rank in the preliminary quiz. Aditi Goyal, Shaktivel, Manav, Hema, Joyce. I think everybody's having lunch. Pooja, Diksha, Nidhisha, Fazlu, and Saurabh. There's only one person inside. Or you can have the lunch break.
So, no problem. So we'll break for lunch. Okay. And then we'll come. So we are not continuing lunch break, and please simultaneously, and those who want to go for lunch and go. Yeah, I know, but this is very sufficient.
It's already time. Okay. Okay, we don't need teams, and we have 4 people. They will. So, Shaktivel. So you can be team A. Joyce B. Diksha C. And Nidhisha D. So we have 4 people, 4 teams, and we'll be having 3 rounds. The first round is an MCQ round. There will be a question projected on the screen, and the teams will be asked in order. So there is no need to raise your hands, no need to buzz, and please do not speak out of turn because that will disqualify you. And the first team which gets the question addressed to them, if they answer it correctly, they get 2 marks. If it gets passed to the second person, they get 1 mark for answering correctly. And if it goes to the third person, they get half a mark for answering correctly. Then it does not go forward. And we will have 20 questions like this, and then we'll move on to rounds 2 and 3. Dr. Renu Madan will be asking the question.
So, good afternoon, everyone. Thank you, organizers, for this beautifully organized meeting. So, as Dr. Shikha told, we will be having the quiz in 3 rounds. In one round, round 1, there will be 20 questions, 2 marks each. So, the first question is for team A, and you will get 30 seconds to answer that question. Which of the following is not a criteria for WHO grading of astrocytoma, that is histopathological grading? So your options are nuclear atypia, mitosis, necrosis, or hypervascularity. Hypervascularity is the correct answer.
Hypervascularity.
So the second question is for team B. What percentage of brain tumors are malignant? And options are 25 to 30%, 45 to 50%, 65 to 70%, or more than 75%. So that's the wrong answer. Around 29 to 30% brain tumors are actually malignant. So the next question is for team C. Which entity is not a part of WHO CNS 2021 classification? Glioblastoma IDH wild type, diffuse hemispheric glioma, H3G34 mutant, glioblastoma IDH mutant type, or spinal ependymoma, MIC and amplified.
Ma'am, answer is D. Spinal ependymoma and Weissman amplified.
No, that's the wrong answer. Answer is C, glioblastoma IDH mutant type. It is grade 4 astrocytoma. So for team D, the question is, which of the following is a common genetic alteration in oligodendroglioma, that is IDH mutant and 1p19q co-deleted? So options are ATRX mutation, BRAF V600E mutation, EGFR amplification, P53 mutation, or third promoter mutation.
ATRX mutation.
So that is the wrong answer. The correct answer is third promoter mutation. So for team A, next question is, which of the following does not represent pediatric type high-grade glioma? Diffuse midline glioma, H3K27M altered, diffuse hemispheric glioma, H3G34 mutant, diffuse glioma, H3 wild type, IDH wild type, or diffuse astrocytoma, MYBL1 altered.
Option D, diffuse astrocytoma MYB.
That's correct answer. For team B, next question is, which of the following does not qualify as LEAT, that is long-term epilepsy-associated tumors? Options are angiocentric glioma, diffuse hemispheric glioma, H3G34 mutant, pilocytic astrocytoma, or polymorphous low-grade neuroepithelial tumor of the young. Use the mic.
Option C.
Your time is up and your answer is wrong. So it's B, diffuse hemispheric glioma, H3 G34 mutant. So the next question is for team C. Which of the following is not true for H3 G34 mutant glioma? It's exclusive to cerebral hemisphere. ATRX loss is common. MGMT promoter methylation is seen in more than 60% of the patients, and the grade varies from grade 2 to grade 4.
Grade 2 to grade 4.
The correct answer. It's high grade glioma, grade 4. So for team D, next question is, which is the most common location of intracranial germ cell tumor? Pineal region, suprasellar, basal ganglia, or thalamus?
Suprasellar.
It's pineal. Pineal and suprasellar both are common, but pineal is twice as common as compared to suprasellar tumors. So pineal region is the correct answer. So for team A, which of the following is least commonly seen in astrocytic tumors? 1p19q co-deletion, p53 mutation, ATRX mutation, or EGFR mutation?
1P19.
That's right. So for team B, which is not true for Catnon trial. So in Catnon trial, they analyzed 1P19Q non-correlated patients of anaplastic glioma. Concurrent temozolomide improved overall survival, adjuvant temozolomide improved overall survival, or clinical benefit was dependent of IDH mutational status.
Option B.
Option B is the right answer. You said option D. D is wrong. So concurrent temozolomide did not improve overall survival in Catnon trial in 1P19Q non-correlated gliomas. So for team C, next question is, temozolomide has a therapeutic role in the management of all of the following except diffuse astrocytoma, aggressive pituitary adenoma, angiocentric glioma, or brain metastasis from malignant melanoma.
Ma'am, answer is D, brain metastasis from malignant melanoma.
No, the answer is angiocentric glioma. It's low grade, grade 1 tumor, and usually surgery is curative in these patients. So no role of adjuvant temozolomide. So this would be for team D. When was the first WHO classification of brain tumor published? 1965, 73, 79, or 1981?
73.
79. So first was in 79, second was in 93, then 2000, 2017, 16, and the latest classification. So for team A, craniospinal irradiation is recommended for adjuvant management in all except group 3 medulloblastoma, diffuse intrinsic pontine glioma, recurrent posterior fossa A ependymoma, or choroid plexus carcinoma.
Diffuse intrinsic pontine glioma.
That's right answer. So for team B, which of the following is not a real-time intraoperative technique for brain tumor surgery? Your options are preoperative MRI-based neuronavigation, intraoperative MRI, intraoperative ultrasound, or LADI.
Option A. Option A.
Option
A.
A.
Pre-op.
That's right answer. For team C, the question is, which of the following is not true about Renu criteria for brain tumors? So your options are A, Renu criteria are volumetric as opposed to RECIST, which is two-dimensional. Renu criteria used contrast and flare MRI, while RECIST used only contrast MRI. Renu criteria use product of perpendicular diameter, while RECIST uses sum of the longest diameter, and Renu criteria incorporate steroid use, while RECIST criteria do not, which is not true for Renu criteria.
A. Option A.
Option A is the right answer. So for team D, the concordance between surgeon-defined gross total resection and post-operative MRI-defined gross total resection in glioma is approximately how much, how many percent? 55%, 70%, 85%, or 90%?
85%.
70%. Then for team A, which of the following does not confer a poor prognosis in IDH mutant astrocytoma? Total copy number variations, total mutational burden, ISO 19Q loss, or PIK3CA alteration?
Total copy number variation.
the wrong answer. The right answer is ISO 19Q loss, which is favorable prognostic. For team B, what is the radiation tolerance of cochlea for fractionated radiotherapy according to Quantec? Mean dose less than 30 gray, max dose less than 30 gray, mean dose less than 45 gray, or max dose less than 45 gray?
C.
Mean dose less than or equal to 45 gray. So for team C, the question is, which statement about adult low-grade glioma is incorrect? Delaying radiotherapy after complete tumor excision in young patients reduces overall survival. Higher dose of radiotherapy after subtotal resection does not improve local control. Adding chemotherapy after adjuvant radiotherapy improves overall survival for older patients. And patients with bilateral astrocytoma presenting with neurological deficit derive benefit from concurrent chemoradiation. Which of the statement is incorrect?
B. Option B, higher dose of radiotherapy after subtotal resection does not improve local control.
The answer is A. Delaying radiotherapy after complete tumor excision does not improve overall survival. Actually, it only improves disease-free survival. So this is the incorrect statement. So the last question for round 1 is for team D. Which of the following is not a diagnostic criteria for glioblastoma in a patient with histologically grade 2 diffuse astrocytoma? IDH mutation positive, or demonstration of +7 or minus gain of 7 and loss of 10 chromosome, EGFR amplification, or TERT promoter mutation? B. A is the right answer, IDH mutation positive. Rest of the 3, if they are present in low grade astrocytoma, they upgrade the grade to higher grade or glioblastoma. So we have done with round 1. Dr. Shikha will be telling the rules for second round.
So round 2 is just 4 questions, and we do not have multiple choice in the second round. And so for round A, team A is at 8 points, team B and C both at 4 points, and team D at 2 points. So the second round, you get 2 marks for answering the complete question. Each question has 2 subparts, and you get 1 mark for answering each of the subpart. We'll ask, there'll be 4 questions for the 4 teams, and we can pass the question to the next if the person to whom it is addressed is not able to answer. So the other person will get the same number of marks, 1 for each subpart.
So we'll start with team A. So identify the MRI sequence.
T2 flare.
This is the wrong answer. Team B,
T2 weighted image.
wrong answer.
T1 not.
Your time is over now. See,
Ma'am, T1 image,
contrast, non-contrast.
non-contrast, and structure is
Which is this structure?
pineal gland. Corpus. Ma'am, pineal gland.
Pineal gland. This is thalamus. Okay, so you will get 1 mark for this question. So the next question is for team B. So name the foramina. This foramina.
Foramen oval.
That's right answer. And nerves passing through the foramen oval.
Mandibular nerve.
Can you clarify more? Mandibular nerve. Mandibular branch of trigeminal nerve.
Mandibular branch of
And?
trigeminal nerve.
Okay, that is the right answer. Mandibular branch of trigeminal nerve. So for team C,
Lars Lexer. Lars Lexer.
correct. So the next question for you is, where was the first clinical gamma knife unit installed? In which country or city?
Germany.
In Sweden.
The answer is Stockholm, Sweden.
Stockholm, Sweden. So for team D, the question is, an elderly lady who complained of frequent headache and tinnitus for 4 years. MRI showed this tumor in the CP angle tumor, which is around 2.5 centimeter in size and abutting brainstem and having intracanalicular extension. So what is the most probable diagnosis?
Vestibular schwannoma.
Vestibular schwannoma is the diagnosis. And what is the grading system we use for vestibular schwannoma?
Vestibular. We have the semi-grade also, the core system also.
Cool. So this is about round 2.
So round 3 again has clinical case questions. So 1 question per team, and there will be subparts. 1 mark will be given for each correctly answered subpart. So after round 2, team A has 8 marks. Team B and C again tied at 6, and team D at 4. So this is the last round. If there is a tie between 1 and 2 or a tie between 2 and 3, we'll need a couple of tiebreaker questions to separate.
So for team A, our question is, 3-year-old boy presented with symptoms of obstructive hydrocephalus. On contrast enhanced MRI of the brain, a space occupying lesion was seen in posterior fossa arising from roof of 4th ventricle, which was extending to upper cervical cord through cisterna magna. Calcification was present in the tumor. So what is your most probable diagnosis?
So posterior fossa tumor, most likely based on the age group, it's a PNET, could probably be a medulloblastoma since fits into that age group.
So
We have given you a lot of clues.
there is a calcification, the tumor is extending through cisterna magna arising from roof of 4th ventricle.
Could be an ependymoma.
So ependymoma is the answer. So what staging worker you would like to do in these cases?
It's a posterior fossa tumor, and with extending to upper cervical cord and cisterna magna, I want to get a MRI spine as well, screening, and if possible, CSF cytology.
So even if it is not extending to upper cervical cord, you will do this metastatic workup. For team B, a 2-year-old child presented with nystagmus. Corporal testing showed poor vision in both eyes, and MRI brain showed enhancing lesion involving optic chiasma and optic radiations. Genetic testing shows mutation in chromosome 17q. So what is your most probable diagnosis? So there is a mutation in chromosome 17q.
Pilocytic astrocyte.
So would you like to elaborate it more?
Optic.
This question will pass on to the next.
Pituitary adenoma.
No, next.
Optic pathway glioma and neurofibromatosis.
Yes, that is the right answer. Their neurofibromatosis is a tumor suppressor gene, which is situated at chromosome 17q. So there is a mutation, and optic pathway gliomas are most common tumor in neurofibromatosis 1. So now for team D, what would be your treatment of choice? Complete surgical excision, radical radiotherapy, partial excision, and reserve adjuvant radiotherapy for progression, or chemotherapy?
Partial excision with
So you would like to do surgery in optic pathway gliomas?
debulking, yeah. Neurofibromatosis.
Chemotherapy is the right answer, especially if the child is young. And these tumors, they have tendency for spontaneous regression, but because the tumor is large enough and child is symptomatic, so we will have to treat, and chemotherapy is the treatment of choice. For team C, a 42-year-old man presented to emergency room with new onset seizures. On CT scan, a calcified lesion was seen in right frontal lobe, and on MRI, the non-enhancing infiltrating mass lesion was seen in the right frontal lobe. The patient underwent gross total resection of the tumor, and histology showed closely packed cells with small round monotonous nuclei with perinuclear clearing, giving it as a fried egg appearance. So what is your diagnosis?
Astrocytoma.
Team D,
Oligodendroglioma.
oligodendroglioma is the answer. Now, what molecular features are most likely present in this patient? So your options are EGFR amplification, IDH mutation, third promoter mutation, or ATRX retained. Third option is IDH mutation, P53 mutation, ATRX mutation, or polysomy 7, monosomy 10.
IDH, P53 and ATRXC.
IDH, TERT, and ATRX retained. B, second is the option. So this is the last question for team D. A 12-year-old boy presented with features suggesting obstructive hydrocephalus from last 4 weeks, and MRI of the brain revealed a space occupying lesion in the pineal region. A stereotactic biopsy was done, which is suggestive of germ cell tumor. VP shunt was placed, and metastatic workup revealed AFP level of 1500 microgram per liter. MRI spine did not reveal any abnormality. So which therapy has the best outcome in this patient? Could be the best outcome.
Chemotherapy alone.
Team A.
So chemotherapy followed by CSI.
What is your probable diagnosis?
Germ cell tumor.
Non-seminomatous germ cell tumor,
No,
likely.
germ
So
cell.
chemotherapy followed by
Uh,
craniosspinal radiotherapy. So for team A, what is the role of surgery in non-seminomatous germ cell tumors? Do you ever do surgery in these patients?
Usually reserved. No.
Never.
Pass.
So team B, you want to answer? You want to answer?
Non-responsive tumors only.
So if there is a residual disease after completion of chemoradiotherapy, or if the tumor is immature, if it is mature teratoma after histopathological diagnosis, which does not require any additional treatment. So yeah, this is the last.
So we have the scores of the 4 teams. Team A is leading with 11 points. Team D is at 7 points, and Team B and C are maintaining their tie at 6 points. So the winner is Team A, and second is Team D. So that brings us to the end of the quiz. We'll hand over to the organizers.
Thank you so much.
Thank you for conducting such an interesting quiz.